So today I'm here to teach you about anemia due to blood loss. A little bit about myself. I'm Aman Praveen, a second year medical college student in SMMC India. I'm not only a medical student but also a karateka. So let's get started. Today we'll be discussing about anemia due to blood loss. First of all, what is anemia? Anemia is basically the reduction in red cell mass, thereby causing decrease in oxygen carrying capacity of the blood loss. It can be classified into two subtopics. Okay, the first one is acute blood loss. The second one is chronic blood loss. Acute blood loss is caused due to certain etiologies, such as a trauma in an accident. When a blood vessel gets cut, blood comes out, that causes anemia. In a surgery, blood gets wasted, that causes anemia. In a hemorrhage, in an organ rupture, you see, when these organs have blood supplies, right? When it ruptures, the blood vessels which supply the organ also get damaged, thereby causing outflow of blood from it. Chronic, the etiologies are such as peptic ulcer disease. What happens is the lining of the stomach wears out, and the acid goes and erodes the lining of the stomach, thereby damaging it and causes slow blood loss. Parasitic infections. These parasites, which get into our systems, what they do is they slowly attach to our organs and then slowly, suck out blood. In piles and in calcification of the colon, chronic blood loss is seen. Let's get deeper into acute blood loss. We get hurt. You see, blood is being lost right now. So what happens is our body, to compensate that, it increases the platelet count, and that platelet goes and clogs and makes clots and stops the blood loss, thereby causing thrombocytosis. Thrombocytosis is immediately observed in acute blood loss. After this blood loss has happened and a clot occurs and bleeding is stopped, in a few days our body realizes that, oh no, we don't have enough RBCs to supply oxygen to our organs. For that, what happens is the bone marrow gets pressurized. It gets pressurized, and we need more red blood cells to supply oxygen, do heavy duty work, send more RBCs to us, our body demands, and the bone marrow in that stress crumbles. What it does is it sends out immature RBCs, otherwise known as reticulocytes. Reticulocytes are progenitors of RBCs, which are sent in under these conditions. So in 5 to 7 days, reticulocytosis is observed. These reticulocytes are basically larger in volume than the RBCs. That is why the mean corpuscle volume is greater than 100 in this case. And then granulocytosis is also observed. You see, when a blood vessel is damaged, it is susceptible to other infections. To prevent that, our body pumps up our immune system and causes production of granulocytes, which is a type of WBC. Now let's get into chronic blood loss. In chronic blood loss, microcytic hypochromic RBCs are usually observed. In certain cases, macrocytic anemia is also observed, like in vitamin B12 deficiency. It leads to iron deficiency anemia. I hope this video was really useful for you, and make sure you leave a thumbs up, a very nice comment below, and to click that subscribe button if you haven't yet. Thanks for watching.